Hi, this is a new series that we're starting, and I have with me Abby and Wu. We're trying to decide how to name this series, and Abby is suggesting um, inquiry into the secrets of therapy, and I'm suggesting inquiry into the burning questions of therapy or about therapy. We don't want this series to be sort of question and answer because we don't believe that there's any definitive answer to big questions about something as infinitely complex as therapy. But we want it to be a dialogue that in which we're all inquiring into these questions, and the questions are being given life and being addressed. And that's really loving the questions is one of the main things, right? Really giving them space and attention. And so Abby will be uh, suggesting some questions for us to think about for a few minutes, and then she'll be asking some other therapists and some of the other younger people in our community will also be asking questions, and we're going to put this all together into a series. The series is for therapists, of course, who want to consider these questions, for clients and patients for whom these questions are very important, and also for a growing number of people, especially focusing oriented people, who are helpers, who are working with people, but are not considering themselves therapists or taking on the role of therapist, but more the role of helper, coach, guide, things like that. So let me bring you into this, Abby, what you would want this series to be. What do you think would be an important contribution that this series could make?
I think therapy is very experiential, and uh, a lot of the learning comes from the doing. So, by speaking to individuals who've been in the field for a long time, and for me, personally, as I'm practicing with people holding space, um, like there are elements of therapy that stands out to be essential that um, is not as much of a focus in terms of training for other um, modalities or ways of holding space. So I think there are some things that, like, by speaking to you elders about it, can make the work I do more effective. And then also, I think in some ways, for me, it's to place therapy in the context of the helping profession. Of
Mm-hmm.
what is the orientation of therapy and what is its aims,
Mm-hmm.
um, and how to really co- contrast that, because I think people in their different developmental stages need different type of support, and so different types of therapy help people in different stages, and then other modalities of holding space for different other types of developments. So that's where I think my curiosities and interests lie.
Yeah, that's very interesting, Abby, that you want to distinguish what therapy attends to and what other kinds of helping attends to, or other kinds of, as you put it, holding space does. And usually therapists are always inquiring into the different kinds of therapy, but you're inquiring into what all these therapies have in common and the difference between therapy and the other helping professions. So that's really interesting.